Car seats reduce risk of fatal injury by 71% in infants younger than 1 year old and 54% for 1 to 4 years old. Make sure to use federally approved rear-facing safety seats with a 5-point safety harness over both shoulders, hips, and to buckle at the crotch. Keep the clip at armpit level. Remove bulky clothing like winter coats, and that can cause the straps to loosen and place baby at risk for injuries. Instead, dress them in warm, thin layers, placing the coat or blanket over the straps to keep them warm. Angle seat at 45 degrees to prevent slumping and airway obstruction, or you can use tightly rolled blankets on either side of the baby for assistance. Never put the baby in the front seat due to the airbag injuries, and to make sure you read your car manual regarding the side airbags. And infants born less than 37 weeks should be observed for 90 to 120 minutes for the infant car seat challenge. Monitor for apnea, bradycardia, and any decreased oxygen saturation. Use a federal motor vehicle safety car bed if necessary, and safe car seats based on the baby's age, height, weight, and the type of vehicle is safest until about the age of 5. And for any information, you can go to National Child Passenger Safety Certified Technicians for more information.
So some behavioral changes in children with newborn siblings include inappropriate reactions of siblings that result from temporary separation from the mother, changes in the father or mother's behavior, and the infant coming home. It's important to expect your child to have mixed feelings and reactions and show compassion towards them. Some behavioral changes in the sibling include acting clingier, throwing more tantrums, and expressing negative feelings towards the baby, such as announcing that they wish it would just go away. What to do about it as parents. Tell your child about their babyhood, how they were born and fed, and how you rocked them and shared many hugs and kisses. This prepares the older sibling for the kind of behavior moms and dads show for new babies. Give your child a new doll so they can practice for a baby too. Involve your child in preparation for the baby's arrival. This means helping pack the hospital bag, picking out the baby's coming home clothing, and helping decide on a new name for their sibling. Talk, hold, and show affection to the older sibling whenever you see signs of jealousy or regressive behavior. Reassure your child and offer praise for their big brother or big sister role. Involve your child in helping care for the new baby. Ask your child to fold or bring diapers to you, hold the baby with supervision, smile, and talk to the baby. This allows the child to feel part of the care of the baby with parents.
First-time parents struggle with what to do when bringing a baby home for the first time when there's pets in the house. Here are some tips that you can use to help the transition. Playing songs of baby noises to expose them to new sounds before the baby comes helps. Make gradual changes throughout the house so it's less stressful on the pet. Give dogs and cats time to adjust to baby gates and a new baby room before they arrive. If you have a cat, use a netting to cover the crib so they don't scratch it. Cutting back time spent with the animal can be eased by doing more quality activities. When walking your dog, bringing a baby stroller and maybe a baby doll can help for them to adjust not being the only child. When the baby arrives, before the baby comes home, introduce their scent to the pet. Send someone home with a blanket or a piece of clothing so they can get used to the smell and investigate. When you get home, have someone else carry the baby in. If the pet gets too excited, do not punish the pet. Simply take the baby away and let the dog adjust and try again. Occupying the dog's attention with food-based toys like Kong with frozen fruits or frozen yogurt can help distract them and make them feel welcome.
According to the CDC, about 3,500 infants die each year from a sleep-related death. In the 1990s, the National Back to Sleep caused a significant decline in infant deaths. The ABCs of sleep safety should still be followed by all parents to encourage safe sleep with a new child. A stands for alone. You should supply a firm mattress and allow the child to sleep solo. B stands for back. Position the baby on their back while sleeping, even during napping. C is for crib. You want nothing else other than the child in their crib. This means no bumpers, no stuffed animals, no extra blankets. Do not overheat the baby by bundling them too tight, as this could cause respiratory distress. Breastfeeding will significantly decrease the chances of SIDS in children. These factors have no relation to tummy time with a baby, which is still very important.